Did you know that diabetes isn't just one disease? It's actually a group of metabolic disorders, each with different causes, symptoms, and treatments. And today, we're breaking them all down clearly, quickly, and in plain language. Let's dive into the many faces of diabetes, because accurate diagnosis can save lives. Let's start with one you've probably never heard of: type 5 diabetes, also called malnutrition-related diabetes. It's proposed to be linked to severe malnutrition, mostly seen in developing countries. Poor nutrition damages the pancreas, especially the insulin-producing beta cells. Sadly, it carries a high risk of death, up to 50% within a year of diagnosis. But early nutrition intervention plus insulin can make a big difference. Next up, type 1 diabetes. This one's caused by the immune system attacking its own pancreas, usually triggered by genes and environment. It hits suddenly, often in children, and always requires lifelong insulin. Blood tests look for specific autoantibodies and a low C-peptide level. Then we have type 2 diabetes, by far the most common. It's driven by insulin resistance, often from obesity, inactivity, and genetics. It sneaks up slowly, typically in adults, and treatment starts with diet, oral meds, or sometimes insulin. Unlike type 1, type 2 patients usually have normal or high C-peptide and no autoantibodies. Now here's one that's often missed: type 3C, or pancreatogenic diabetes. It happens when the pancreas is damaged, from things like chronic pancreatitis, surgery, or cystic fibrosis. These patients don't just lose insulin, they also lose digestive enzymes, which leads to malnutrition and wild swings in blood sugar. Treatment includes both insulin and enzyme replacement. Gestational diabetes shows up during pregnancy, typically between weeks 24 and 28. Hormonal changes create insulin resistance. It usually disappears after birth, but raises the risk of future type 2 diabetes. Then there's neonatal diabetes, diagnosed in babies under 6 months old. This one's genetic, not autoimmune, and may be temporary or permanent. Treatment varies. Some babies need insulin. Others respond to oral meds like sulfonylureas. Ever heard of steroid-induced diabetes? It happens with long-term corticosteroid use, think prednisone. It mimics type 2, but often goes away once the steroids stop. Until then, blood sugar needs close monitoring and medication. Then there's LADA, latent autoimmune diabetes in adults. It acts like type 1 but shows up after age 30 and progresses slowly. Many are misdiagnosed as type 2, but tests can reveal GAD65 autoantibodies. Over time, these patients will need insulin too. MODY, or maturity-onset diabetes of the young, is inherited and caused by a single gene mutation. It shows up before age 25, often with mild symptoms, and is frequently misdiagnosed as type 1 or 2. A genetic test can confirm it, and the treatment? Tailored to the gene involved. Some don't need insulin at all. Then there's Wolfram Syndrome, also known as STID-mode. It's rare, recessive, and involves childhood diabetes plus optic atrophy, deafness, and brain issues. There's no cure yet, but knowing the diagnosis helps manage symptoms early. Before we move on, here's a simple way to remember the 10 types of diabetes. Just think: ARDGY. That's A for autoimmune like type 1 and LADA. R for resistance, think type 2 and gestational diabetes. D for damage or dysfunction. That's type 3C, type 5, and steroid-induced diabetes. G for genetic, which includes MODY, neonatal diabetes, and Wolfram Syndrome. And Y for young onset, because these 5 types often show up early in life. MODY, neonatal, Wolfram, type 1 and type 5. This ARDGY framework isn't just a memory trick, it highlights how each group has different causes, risks, and treatments. And now, let's talk about why getting the right diagnosis is absolutely critical. So, why does all this matter? Because each diabetes type needs targeted care. Type 1 and LADA? Early insulin saves lives. MODY, or neonatal. Avoid insulin if oral meds work better. Type 3C, or steroid-induced. Treat the underlying problem, not just the blood sugar. Misdiagnosis can lead to serious complications like a LADA patient going without insulin too long, or a MODY patient needlessly using it for years. Diabetes isn't one size fits all, it's a spectrum. Recognizing its diversity means better treatment, fewer mistakes, and more hope for patients and families. So, next time you hear diabetes, ask the most important question. What type is it? Like, share, and subscribe for more science-backed health breakdowns. Stay informed and stay empowered.